afternoon. I'm Dr. Petra Casey, and I'm really excited to share with you some thoughts about an upcoming article that's going to appear in Mayo Clinic Proceedings in the June issue. It is entitled Emergency Contraception, and my colleagues and I have attempted to share some thoughts about what types of emergency contraception are out there for women to use and why they might want to consider one or the other, and then looking also at some relative efficacy for the different types. As you know, Concise Review is supposed to be a very clear and clinically oriented piece for clinicians to be able to digest in the midst of their very busy practices and to apply right away meaningfully to their practice. So as part of that, there are some continuing medical education questions that are attached to this. And we would like to encourage you to go ahead and read it and learn a bit more about emergency contraception, which should be a consideration for any woman who has had unprotected intercourse for whatever reason and does not wish to become pregnant. I would like to also call your attention to Table 2 in the piece, which talks about how emergency contraception can be incorporated into a discussion during a routine health visit for women, and some questions that providers can consider asking women as to their need for emergency contraception. Most often, advanced provision of emergency contraception is most effective because then a woman can use it even before calling her provider, and having that on hand does increase the efficacy of the contraceptive as well as the likelihood that it will be used and used correctly in a timely fashion. We hope that you will enjoy reading this article, that it will be informative for you and meaningful to your practice, and thank you for the opportunity to share our thoughts.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.